All right. Well, welcome. This is a unique opportunity. My name is Sarah Woolsey. I am medical director with Comagine Health, and I'm here with Dr. Harry Krulewitch, and we are going to be talking about his personal experience in experiencing and recovering from COVID-19. Thanks for being here today.
Thank you.
Yes. So I understand you're an instructor at Oregon Health Sciences University. You teach medical students. You also have a long history as a leader, a geriatrician, a medical director of various nursing facilities. And very personally, in March, you tested positive for COVID-19. And you spent a month in isolation, both from the outside world and from your parents who are in their 90s living in their home. And thankfully, you were able to treat yourself at home. You didn't have to be hospitalized. But given your unique perspective as a long-term clinician, specifically caring for our most vulnerable patients, and having experience with the nursing facility world, and having this experience, we're going to talk today about what you'd like to say to those of us that are caring for patients in nursing facilities, our leadership, on how we can best support individuals that are living with COVID-19 and recovering from COVID-19, specifically in a nursing facility, but just in general. So let's get started.
Great.
Okay. So tell us a little bit about your COVID-19 story.
So I am a family doctor, fellowship trained in geriatrics, and actually currently I'm doing a lot of education with the family practice department, developing curriculum in palliative care. So it was quite ironic that I went to a social event on February 28th and then May 8th. And at both times people were coughing. I didn't get sick in the interim, but I began to cough on May 9th. And on 2-3 days before that, I'd made rounds at nursing homes where I'd put 3 people into quarantine. On March 10th, I began to cough so severely that I started spiking high fevers. I just knew.
Yeah.
As a geriatrician who'd been studying and going to the webinars already, this is it. Yeah. And I immediately put myself into lockdown and met with my family and had a big discussion. My symptoms by the 10th were headaches, chills, fever, nausea. I had severe anorexia, loss of taste and smell, and began to experience shortness of breath. So the challenge there was that that's easy for me to say as a physician. I'm also a 70-year-old, generally very healthy man. My partner, Kathleen, my wife of 43 years, is 69. She has high blood pressure and is otherwise healthy. And we are the caregivers for 2 95-year-old adults.
Oh my goodness.
We moved into our house a year ago, my father and my stepmother. My dad has already chosen not to pursue chemotherapy for lung cancer and is in a palliative care program with Providence, which is wonderful. And my stepmom has a number of medical problems from post chemotherapy and radiation for breast cancer 10 years ago.
Wow. So you're not only a caretaker of patients in facilities and a teacher, you are in the home caretaker of your elderly mother and father, and then you also have a wife that you're concerned about. What was that like emotionally?
Yeah, so the very first piece that I would share with folks that I went through is there's just a rush of emotion. And there was a rush of emotion not only for me, but through the whole household. Because people were struggling with the feelings of, we really care for you, but we're scared for ourselves.
Yeah.
And what are you going to do? And you're a doctor. So for God's sakes, how are you going to respond to this? So we called a team meeting. I have adult children in town, nieces, nephews, good friends. And within a day, one of my sons that lives in town, basically in what I quickly saw was in music, said, Dad, here's the deal. We can't afford to lose you, and we don't want to lose Grandma and Grandpa. We've got a basement downstairs. We're setting it up for you. They're in the apartment that you helped build for them a year ago, and we're putting Mom in the back bedroom. There's a good 20 to 30 yards apart from each of you in a 2-level house, and no one is to go into the living room, dining room, or kitchen.
Yeah.
You've each got your own bathroom, and we will have a schedule of ourselves taking menus online and dropping food off for each of the three of you.
Yeah.
And Mom, we don't want you interacting with Grandma and Grandpa either because you've been with Dad.
Yeah.
And you could be asymptomatic carrier at this point.
Yeah.
And so we can't afford to have any contact between you. So for me, that was the first feeling with the rush of emotions was fear.
Yeah.
Generosity and gratitude that I had family helping me.
Yes.
And so I was bouncing back and forth from this is really, and then amusement, like, are they really going to pull this off? And then realizing, oh yeah, I have to cooperate.
Yeah. And you have to go with the plan.
I have to go with the plan.
Yeah.
And I really can't be the doctor and the patriarch in charge.
Mm-hmm.
My kids are running the show. They're caregivers. So immediately what staff need to realize is that family members who've never been in that role suddenly, because of the severity and the suddenness of the disease, it comes on so quick and that people are stepping into new roles right away.
Yeah. Yeah.
And
Got that.
I had to step into the sick role, which I didn't like.
Mm-hmm.
So I had anger and resentment. I was very scared. I called my internist. He, checked in. Does anyone know how to monitor you? Well, not really. My wife's not a nurse.
Yeah.
I had my 95-year-old checking. My kids didn't want to come into the building. They were gowning and masking and dropping food off by the side door.
Sure.
So I had to monitor myself. And it took me 5 days to get oximetry, even though I was very short of breath.
Yeah.
So the first set of feelings I had as the dyspnea and the cough and the fevers became more severe. And I'm reading about older adults whose symptoms are most severe between 9 and 14 days.
Sure.
I was having panic attacks in the middle of the night.
Yeah.
I'm down in the basement. I'm coughing. I'm short of breath. What if nobody sees me turn blue?
Yeah. I got that. Well,
Yeah.
and when you got the oximeter, did it help?
Yes.
Reassure you. So having information.
I made that mandatory for all my facilities. I said, I want to make sure we have plenty of oximetries available for everyone.
Yeah.
Because checking my oximetry not only reduced my anxiety, but early on, my stepmother developed diarrhea and nasal congestion for 2 days. My wife had nausea and anorexia for 3 days and a cough. They couldn't get tested because in the first weeks of March, the Oregon Health Association and the state health departments said that there weren't enough testing unless you were sick enough to go to the hospital. So in addition to the fear and the panic, now there was rage.
Yeah. Yeah.
Because I was enraged that even a doctor doesn't have the clout to get my family tested.
Mm-hmm.
I have 3 high-risk people in the building.
Yeah. Yeah.
A 69-year-old wife with high blood pressure and 2 95-year-olds with serious chronic disease.
Yeah. Yeah.
And I couldn't get anyone tested. So it came down to, okay, mitigation has to work.
Yeah.
And we're going to have to comply with this. With the oximetry, not only was I checking, but I was cleaning it off every day and leaving it for my dad. And he would walk into the kitchen and he would have himself and my stepmom tested, and it reduced everyone's anxiety to know that everybody was running at 95% or higher.
Yeah. Yeah. No, I mean, I would just say what I want to call out is information makes a difference.
Yeah.
And not just information about how you are for you, but also for your family members. And, what's the status of those other folks? I really hear a message there that updating family with important things like oximetry numbers might really make a difference for them to know how their loved one is doing.
Yeah, and the other piece is meeting right away, no delays, and setting down very clear guidelines. This is how to use PPE.
Yes.
This is what's expected of a quarantine. No exceptions. Your uncle that thinks it's a big joke, that thinks, the government's a conspiracy, he can't just come barging in, take his mask off, not wash his hands, and start chatting with everyone.
Yeah.
He's exposed to who knows how many other adults.
Yes.
He can't even be in the house, period.
Yeah. So just really the seriousness, of the infectivity.
Yeah. So educating the family. My kids were online constantly. They were having panic attacks because they couldn't get through to their doctors. They didn't know who to talk to.
Mm-hmm.
They're in their 30s. And my wife finally called her internist, and my internist talked to her, and then her internist talked to her. And we realized how important it is for the primary care doctors and the medical teams to be calling the caregivers.
Yes.
Not just the patient.
Not just the patient. Good. That's great. That's great information. So then thinking about when you were experiencing symptoms, when you were having those feelings of shortness of breath or cough or fevers, what do you want direct care staff to know when they're supporting someone who has symptoms of COVID-19?
Well, I thought of a couple of different things. First, again, just to recognize me as a person that I have a range of emotions, and that I'm experiencing what I realize with my medical training could be a terminal disease.
Mm-hmm.
That I'm reading about people suddenly becoming hypoxic, crashing and going to the ICU
Yeah.
within days or hours.
Mm-hmm.
And so there's a lot of fear. And we had no one to help with that except our immediate family.
Mm-hmm.
My doctor called me every week to see how I was doing, but no one was checking on me because I was an outpatient.
Yeah. Yeah.
So there were no professional caregivers to help us. My partner had limited training in what I would call hospice chaplaincy.
Okay.
The bottom line is cheerleading doesn't help. Telling someone who knows they could be in the hospital on a respirator within 2 to 3 days that everything's fine, not to worry, is not a good approach. Despite what you may think, and I know a lot of the people we train and work with have the same attitudes as the medical students, which is you're failing if you don't cheer people up.
Yeah.
The truth is, the more effective approach I teach the family practice residents is what I learned in my chaplaincy training, which is just be present.
Yeah.
Be present calmly. Don't be judgmental, and don't be a cheerleader. One of my teachers actually said, practice fearless receptivity. Now,
Mm-hmm.
she was a Buddhist Roshi, nun,
Yeah.
but practicing fearless receptivity resonates with people because it takes a certain amount of courage. The next step in terms of what to look for is I knew how to monitor myself, but I think what I've learned, and I teach the CNAs and the A's in the building, is to have some model on a toolkit for how to do routine monitoring. And I won't go into the details here, but routine monitoring not only helps the family practice provider know, or the PCP, what's changing day to day, but
Mm-hmm.
it's very reassuring to the families and reassuring to the patient that there's a schedule of assessment. The third thing that helped me was a schedule of activities. I suddenly realized, wow, the most important person for me is the activities coordinator,
Okay.
the enrichment volunteer. I got into my own program of meditation 3 times a day because I'm a serious trained meditator. I got into doing spiritual reading. I got back into my painting,
Mm-hmm.
and I painted every day for 30 minutes. Having those, and then I journaled and wrote, and I read fiction. I had my favorite mystery books that I like. And then I had my iPhone, and I had a list of people to call every day.
Yes.
Those activities connected me with the outside world, having some activity that was rewarding to me, and a structure kept me from going nuts.
Yeah.
Because
Well,
otherwise I would have worried and worried and worried and worried.
yeah. Well, and I don't think people know this, but you ended up being isolated for about a month. Is that right?
32 days.
Yeah. And so what I hear is, for many of our folks that live in facilities, likely their quarantine is not just going to last 14 days through their illness, but it's going to last longer many times because of where they live and because of the status of the infectivity of this in our community. So really thinking about a plan that can suit for long term.
And I think that's where sitting down, you know, contact helps, but you can't do direct contact. But having someone sit down and say, what are your favorite activities, whether it's a dementia patient or an alert independent adult, what hobbies can they do? What activities? What other social interactions with the iPhone can they set up? Journaling, reading, writing, music. I didn't play music, but many people enjoy hearing music. We have electronic devices to hear music or play music, but the structure itself gives your day purpose and meaning. And it gave mine purpose. I looked forward to painting. I looked forward in the afternoon to calling certain people. I looked forward in the morning to doing my journaling.
Yes.
And that became my routine. I would nap frequently. I would not eat as much. I had anorexia. I lost 12 pounds.
Okay.
But it never scared me because I had that structure to depend on.
That's great. Question, were there any symptoms of COVID-19 that you have a great tip for treating, like dry mouth or the fever, anything that really helped you that we might not think of?
I would, for my wife who does a lot of yoga, her instructor sent me the SHAOLI and the Shaolin 5 respiratory exercises for chronic disease.
Okay.
And I got online, I Googled Shaolin, it's a Qigong exercise, Qigong.
Okay.
And of course, I am a supporter of Oriental medicine. I've been a supporter of acupuncture for many years, but I don't, and I had done Tai Chi in the past. So I got online and I did that exercise faithfully every morning after a little bit of meditation and journaling. And it brought up a lot of secretions. It was
Okay.
difficult, but I realized, oh my God, these secretions are tenacious, which
Yeah.
then led me to realize I'm not drinking enough water
Uh-huh.
and I need to take an expectorant. So I took a bottle of Robitussin guaifenesin
Mm-hmm.
6 times a day, 5 mLs. So a
Okay.
tablespoon, 6 times a day, not 2, not 3, 6. So I'm now recommending for people with respiratory symptoms, plenty of fluids, respiratory therapy, and expectorant on a regular routine basis. Don't wait. And the other thing is, early in March, we didn't have the evidence about NSAIDs, whether they contributed to exacerbation of the
Yeah.
storm.
Mm-hmm.
So I avoided all non-steroidals and just used acetaminophen for chills, fever, and headache. That was more than sufficient.
Okay, great. That's great to know. So let's move into recovery. So what was it like in the recovery period, and what do you want staff to know about what it's like when, oh, you're over COVID-19, but your body is still, has the effects of having that virus?
So I had to break that down into diagnosing and treating. Diagnosis-wise, I started thinking about as I was getting better, when should I come out?
Yeah.
And the state of Oregon still, even today, says that they would allow for asymptomatic testing of healthcare professionals if the capacity exists and there's sufficient excess supplies.
Okay.
And the answer is they don't have them.
Yeah.
So even now, this late in the game, and I imagine for most providers and family members, I had to go online and find out what are the criteria for coming out of quarantine without testing.
Okay.
Of course, the first thing that scared me was I saw a study as a doctor that I read that said that people were shedding virus in Wuhan 9 days after they were discharged from the hospital.
Yeah.
So I called my friends who were chief of staff around the West Coast, and they all said in their nursing homes, they were not using the 3-day CDC guideline.
Mm-hmm.
Because the CDC said, if you are 14 days from symptoms, well, I was 30 days.
Okay.
And if you were at least 3 days from the last symptom. But the question is, when is really the last cough?
Sure.
When is really the last headache?
Yes.
When was really the last time I didn't really have any appetite?
Yeah.
When was really the last time I woke up sweating in bed? Well, it was yesterday. Well, do I need to wait another 3 and another 3?
Yeah.
And then the thing for families, some of my family members said, oh, you're catastrophizing. You can come out. We can visit with you. So I was telling Leah yesterday, the other thing to remind the staff is you've done all this hard work for 14 days.
Yeah.
Don't let the patient or the family member ruin it all by on the last day saying, you know what, we're not going to wait 3 days. We're not going to wait to 10 days. Whatever you're using for your
number.
timeline,
Okay.
don't give in. People need to be strictly quarantining. And it also would help if you tell the family what your agreements are. If your nurse practitioner says, I think we should go 10 days, and the medical director says, well, I work for the county health department, 3's enough. Well, that's a problem.
Sure. That's confusing.
I'm a doctor, and I sorted that problem out for myself by using the longer length of stay. But I had family members saying, oh, you could do 3 days.
Yeah.
We've called the health department. They said 3 days.
Yes.
We called our doctor, and she said 3 days. Why are you saying 10?
Yeah.
And I said, you know what? I've got 2 95-year-olds I'm in love with, and I don't want to infect them because no one really knows if it's 3 or 10 days.
Yeah.
I'm willing to stay another 7.
So really being clear, sticking to the message and understanding why that's important, and just making it to the end of those days.
Concern with the families that now is not the time to get lax and give up on hand washing, wearing a mask because you disagree with the deadline, and you're going to act as if I'm not contagious.
Got it.
I mean,
got it.
Don't. And then in terms of what I would tell the staff, I had 3 general kind of things. One was consider on the way out that Medicare has relaxed the guidelines for home therapy. And yet, because the doctors weren't seeing me, we didn't have anyone coming to see me for physical therapy, conditioning. I'd lost 12 pounds, but I didn't get any nutritional support. I think people assume, well, you're a family doctor, you know about that.
Yeah, yeah.
But
But you were pretty sick.
Wouldn't mind someone coming by and working with me and doing a little exercise down there, working on my diet.
Yeah.
And so remember, just like I take care of people after hip fracture or stroke, I don't send them home from the SNF and say, well, you're on your own.
Sure.
I mean, we send them home with routine weekly therapy for weeks.
Yeah.
And yet for COVID, Are we thinking of, and what about the social worker? What about helping people make the adjustment back? I wasn't 100% when I came back.
Mm-hmm.
So I had down here not only the therapy, but also consider that there's a lot of psychological change going on. I was somewhat ebullient. I was somewhat hypomanic. For our general listener, I was bouncing from 3 weeks of depression, grief, and isolation to being resilient and hyperactive and wanting to jump back in because I'm a typical
Yes.
male doctor and I want to get right back to work, but I was too weak to do that.
Yeah.
So there's a lot of emotions on the way out, just like there's a lot of emotions on the way in. Maybe there's a role for a social worker.
Yeah.
I didn't think of that myself. I put that all on my wife. I put it all on my friends. And I really didn't have anyone to talk to about what it means. And the final piece is that recovery from a serious illness creates a lot of change and emotional adaptation. As one of my meditation teachers says, change is inevitable, but growth is optional.
Yeah.
And I chose to grow, but that meant that I was really adjusting my goals. Do I really want to be doing certain things as a doctor, as a father, as a husband, as a caregiver? And I think that caregivers and family need help because the person may not want to go back to life as usual.
Yes. Yes.
I mean, things change when you realize you might have been on a ventilator or were on a ventilator.
Yeah.
And you've survived, and you may suddenly decide there's some very important things that are no longer important.
Yeah.
And
Get
your
that.
family may be attached to, why aren't you doing those anymore? What do you mean you don't want to go golfing?
Yeah.
What do you mean you don't want to watch ESPN?
Yeah.
What do you mean you don't want to do this or do that? I think there may be a role not only for PT and OT and nutrition, but some counseling for the caregivers and family members. Because even my grandparents were like, my mom and dad were like, well, aren't you going to do this or that?
Yeah.
And I said, you know, one day a week I don't. One day a week I still want to go downstairs and be alone.
Yeah.
I'm not mad at anybody.
Yeah. Yeah. Got that. So what I hear is in recovery, really listening to where someone's at and looking at both their physical and emotional recovery as unique and as needing whatever it needs and provide those supports, but ask those questions.
And it's no different than any other of the chronic diseases we see as geriatricians in nursing homes, but the sudden rapidity and the intensity of a virus can do this to me.
Yeah.
A stupid virus that's in the head cold family could have put me in the hospital on a respirator with an 80% mortality.
Yeah.
And now I'm coming out the other end. Well, you know what? I really like painting.
Yeah.
I really like painting so much. I think I don't want to be a medical director of so many facilities.
Yeah.
Life's short. Maybe I need to think about, if I'm not going to resign and retire, what does it look like to be 70 years old as a male professional? So I was thinking about these things as I began to recover, certainly not when I was sick.
Got it.
I had no one to chat with about it, but my partner, who's a family therapist, is a pretty darn good person to bounce stuff off of, but I'm very grateful.
Yeah.
So one of the big feelings I had on the way out was sadness that so many people younger than me were suffering more than me.
Yeah.
And realizing, oh my God, I'm reading about people dying at 40, 45, 30, and I didn't, and I made it through. So do I have a right to be happy about this?
Mm-hmm. A little bit of survivor guilt. Yeah.
That, wow, my wife is really a skilled listener. My father is 95, but he's ambulatory.
Yeah. Yeah.
He can still help her shop. I don't have to go home and immediately start to become a caregiver.
Yeah.
I'm very grateful that my dad doesn't have cognitive impairment.
Yeah.
You know, I took it for granted.
Yeah.
And now it's like, oh my God, that's a big deal for my wife. What if she had a 95-year-old with dementia and a husband that was too weak to cook and take care of himself?
Yeah. Yeah.
So gratitude that the kids did that. So those are feelings that are a real gift, but certainly nothing that you look forward to in life.
Yes.
But I could recognize them because I took the time to pay attention and had adult friends like yourself, other physicians, reminding me to like, slow down.
Yeah. Yeah.
Slow down, Harry. Think
and
about
take a
what's
look.
happening here.
Take a look.
Yeah.
Well, I would just say we really appreciate you sharing all the insights, the journey, good and bad. And it's remarkable the way you can speak about something that is pretty terrifying in such a candid way. Is there anything else you want to make sure that we hear that will help us take care of folks as we know this virus is sticking around?
celebration.
Okay.
Yes, I do think that bringing the family as caregivers, the essential workers that did the job, the home care staff that show up, the nurses, the doctors, and the patient, and creating celebration.
Yeah.
I had one hospice company send me a cup that said COVID Warrior Survivor. You know, and I
Yeah.
cried when I got it.
Yeah.
I
Yeah.
tried to say it, and I'm not going to put coffee in that cup.
Yeah.
I put that cup right here on the computer where we're chatting so I can look at it every day.
Yeah.
And I think celebration to honor the courage of other people that help us, knowing that I had a life-threatening illness, but also my resiliency that was a result of everybody's effort. We should take time to celebrate those moments in life too, and not just get back to normal.
Perfect. Those are perfect words. Thank you so much for your time and for sharing this. And we'll look forward to meeting someday in person, I hope. And Leah will take it back to you.